First, to Sudan. The bloodshed we have seen over the past 10 days in Sudan is heartbreaking. In a country whose people have already suffered so much in recent years. WHO welcomes the ceasefire agreed between the parties. We urge all parties to fully respect it. Already, the violence has taken a terrible toll on health. On top of the number of deaths and injuries caused by the conflict itself, WHO expects there will be many more deaths due to outbreaks, lack of access to food and water, and disruptions to essential health services, including immunization. WHO estimates that 1/4 of the lives lost so far could have been saved with access to basic hemorrhage control. But paramedics, nurses, and doctors are unable to access injured civilians, and civilians are unable to access services. In the capital, Khartoum, 61% of health facilities are closed, and only 16% are operating as normal. WHO has stocks of essential medicines, blood bags, supplies for surgery and trauma care waiting for delivery, but we need safe access to do that. As always, the best medicine in this situation is peace. WHO is also concerned about the occupation of the Central Public Health Lab by one of the parties in the conflict. Technicians no longer have access to the laboratory, which means the lab is no longer able to perform its normal diagnostic and reference function. We're also concerned that those occupying the lab could be accidentally exposed to pathogens stored there. WHO is seeking more information and conducting a risk assessment.
This does represent an attack on healthcare. The occupation of a laboratory denies that service to the hospitals, to the doctors, to the patients. And at this time, our primary concern is the health and welfare of the people of Sudan. And right now, the major danger to the health and welfare of the people of Sudan is lack of access to clean water, lack of access to food, the risk of direct injury with guns and tanks and other weapons being used indiscriminately in civilian zones. So when we look at what are the major risks to the civilian population of Sudan, they are the risks.
We're very encouraged by the sustained decline in reported deaths from COVID-19, which have dropped 95% since the beginning of this year. However, some countries are seeing increases, and over the past 4 weeks, 14,000 people lost their lives to this disease. An estimated 1 in 10 infections results in post-COVID-19 condition, suggesting that hundreds of millions of people will need longer-term care. Today, WHO launched the Preparedness and Resilience for Emerging Threats Initiative, or PRET. The acronym is deliberate. PRE means ready in French. Rather than focusing on specific pathogens or diseases, PRET takes an integrated approach to pandemic planning by focusing on groups of pathogens and the systems they affect. To begin with, PRET will focus on respiratory pathogens including influenza, coronavirus, RSV, and as yet unknown pathogens. Pandemics are by definition global events, so PRET is designed to promote collaboration between countries.
The specific work we have been doing to start with this initiative is really first to learn the lessons from COVID. Because we have learned a lot during the past 3 years and we don't want to lose this experience. Second is to maintain also the capacities that were built during COVID, because these capacities have grown in many countries, especially low and middle income countries, and we don't want to lose these capacities. And third is really to integrate the innovation